Soundbytes. Quick clips, long-term learning.
Okay, next case we have a woman who came in her early 30s. She is pregnant, a G1P0, says she's about 13 weeks gestation. She came in with vaginal bleeding and had a clear fluid leakage. What's going on here in this ultrasound?
So in this ultrasound right here, we're looking at the M mode of the uterus, and normally we use the M mode to help calculate fetal heart rate. There's a calculation essentially based on the distance between the heart rate flashes on the M mode, and then this can help calculate the BPM for the baby. And you want to, there's a normal fetal heart rate range, and if we're looking in the right or the left-hand corner, upper left-hand corner, we see it's 190, which is too fast for a fetus at this stage.
Yeah, this is pretty elevated, so it'd be classified as fetal tachycardia. And you're right, you're using M mode, kind of look with the M mode cursor over the fetus's heart and looking for a repeating pattern somewhere within that depth range. And that's how you calculate the fetal heart rate. So we'll go through now live scan of the transverse uterus. So we're looking at the uterus here, the globular structure. And then what do you notice about the fetus here?
Yeah, the top left-hand corner, we see the head or the cranium there, and then as it extends down towards the right, you see the spine of the fetus. One of the things that we're looking for is the amniotic sac, and in this individual, it looks like we're not seeing that large black surrounding sac that we would expect, which is concerning for this fetus.
So if you were speaking with the obstetrician, how would you describe the amniotic sac findings here?
Well, we would say that it's non-existent, or two words to use would be oligohydramnios or anhydramnios, and that there is little to no amniotic fluid in this individual.
Yeah, exactly. So let's take another look at the longitudinal view. We're seeing kind of the same, where the baby's in there, but it really has no fluid surrounding it. So this is unfortunately a grave condition for the baby, and it's unfortunately not survivable in an early gestational age, just because the baby's now exposed to external elements. Technically can increase the risk for the mother to get infection, sepsis, hemorrhage, and unfortunately it's a non-survivable condition for the fetus. It's measuring at 13 weeks and 3 days here.
Okay.
When you're looking through for the fluid, there's really not much to measure here, but have you heard of any other ways that you can measure fluid?
There's a pocket depth gauge that you can do for fluid status, essentially within the amniotic sac, the MVP?
Maximum vertical pocket.
Okay.
But can you use that in first trimester?
I believe that's a second and third trimester tool.
Yeah.
So here it really wouldn't apply.
Right. Yeah, there's nothing to measure here, but also it's not validated in first trimester. It's really only after 16 weeks or so when you can start using the MVP measurement to look for and rate oligohydramnios and polyhydramnios and things like that.
Okay.
What's the diagnosis here?
So for this case, this would be preterm premature rupture of membranes, or PPROM.
Okay. Exactly.
Soundbytes. Quick clips, long-term learning. This soundbite is a shorter, digestible segment taken from our monthly Soundcheck podcast. For the full episode, check out the podcast on YouTube at youtube.com/MedStar Emergency Physicians or visit mepsono.com.